कि khubor ka Batesi TV. Lawan Rashapi taka Frank Motors. Booking open for the new Nexon. Visit Frank Motors or call 7045207973.
MIT University of Meghalaya. Our admissions are now open for the academic year 2024-25. Explore our best courses, experience global collaborations. Apply today.
Namar kajing IQ man laus nam jaga jingpang HIV but AIDS support kajila but shibenta ban pinsngau thopat ba ka Meghalaya State AIDS Control Society hakasian ka basan kan penlong ka Red Fest lima ka North East Multimedia Campaign lor ka phang pedeng North East United Against HIV and AIDS. Yakani ka Red Fest ka Meghalaya State AIDS Control Society kan penlong Hilarity Center for Performing Arts Shillong Meghalaya hakar puprasrik bentau benai rempang. Habakaran jigla pathai khubor ka Dr. B. Cruz kepada ka Project Director kalong bahakan ni ka Red Fest kindan hadu arajar sans pangut kinong shimbenta bakintup naduki head officer ni kitran maper. Nakalang Deputy Director uba Ajoy Lanong ulit hu ba kumbashis pa Introductory ki district Jambaro ki jala ka North East kinuan banyak shimbenta hakan ni ka Red Fest bakindan ru shibun ki kinhon tam maper ki berwani shimbenta lang.
The main objective actually of having this multimedia campaign is actually to create more awareness on HIV and AIDS. So altogether, like all the 88 northeastern states will be gathering like day after tomorrow at Lalati, and each states will be bringing their own respective bands, popular bands like to come and perform. So why, as we all know, because music is the easiest language everybody can understand. So by doing so, by having this musical event, we plan to do so much more with that platform. Also, the objective of this MNC is actually to enhance the risk perception and promote safe sex behavior. Also to issues, especially stigma and discrimination surrounding, especially for people living with HIV. Also to motivate different population groups to seek services such as integrated counseling testing centers, sexually transmitted infection centers, Raksha clinics as we call them, PPTCT, ART, etc. And also for the normalization of condoms. And when we talk about condoms, it's the safest way to prevent HIV. So, like ma'am said, this will cater actually to the youth between the age group of 15 to 29 years. And also, the campaign will reach out to 126 districts all over the Northeast, combining all the Northeastern states in the Northeast. So like Mohammed said, we've actually given you all a press kit, so all the band information is readily available for you all there, as well as the concept note on the Red Fest.
Address of the HIV scenario of Meghalaya first. Okay, so the HIV scenario in Meghalaya is above the national average. We stand at 0.42% the adult prevalence rate, which is higher than the national average, which stands at 0.1%. So that other northeastern states also are higher than the national average. And the main district that are facing more problem on the HIV here are the East Janty Hills and the West Janty Hills. Also now we are starting increasing cases in East Khas Hills and Lyngba district, and also even in West Khas Hills district. When we look at the number, it is more in West Janty, but when we look on the prevalence, it's more in East Janty because the number of people, including on the population. The main cause, routes of transmission is sexual routes, okay, in the Janty Hills, and even in other parts of Meghalaya is mostly from sexual routes. And if we look at the rural area, if we analyze more in the rural area, it's more to sexual routes. But if we look at the urban area, it's more through the injecting routes. That's what when we think of the routes of transmission, okay, when we look from the sexual routes, it's more in the rural areas. But when we look from the injecting drugs, from the injecting routes, it's more in the urban areas.
So the prevalence stands at 2.34%. Nagaland stands at the prevalence is 1.34%. Manipur, the prevalence is at 0.94 and Meghalaya 0.42. So these are the four northeast states with the highest prevalence comparatively with the other northeastern states. Mizoram with a prevalence of 2.34%.
It's keep on increasing. You see, that's why we are calling this press conference also to address, it's not only a health department. This is multifactorial factors. There are so many factors, social factors, the economic factors, as well as the health factors. So what we have done from the health department, we have addressed this issue, and it is a call for other department also, and also for the press to come forward and spread more awareness on this. If we don't do it together, we will not be able to reach. Yes, we do a lot of awareness campaign, what we have just finished in East Jandy Hills. We had conducted this what we call the integrated health campaign. In that campaign, we target both the awareness and also screening and testing. We go to all the villages. We cover 202 villages of East Jandy Hills. We have these what we call the static camps. In the static camps, we integrate together with other health programs like the TB program, the viral hepatitis, and for non-communicable disease, and even for eye screening, dental screening, and because we coordinate together with the district administration, so we also do the Aadhaar enrollment and the MHIS enrollment. In that campaign, it's very successful, whereby a lot of people, we are drawn to the static camp. And then, some of the high-risk group are not coming to the static camp. So we go with these, what we call the extended outreach, where we target only for the high-risk group. So we go to this hotspot area and in the workplace also. So that we covered in around 104 extended outreach. Hotspot area, we have a lot of, because these truckers and the migrants, these are also we call the rich population. So in those areas, we call the hotspot area, where we have lots of, the truckers and the migrants, and also in those places where, those female sex workers are.
First of all, the reason why we're doing a largely, because of the season, and it's winter season, so I was a little bit off the way. But when we talk about screening as well, what Martin has mentioned, the reason why we're placing the mobile ICTC also for the common people, whoever comes to visit the event can actually go for screening and testing at that on the spot. But actually, the main when I said about this event again, when we're having various artists from the Northeast, and with the attraction that we're having 8 bands performing. From Meghalaya, we have 2 bands. One is Somersault and the other is our brand ambassador, which is Toxic Pony. They're here from Jingrwai. And of course, everybody knows Girish and the Chronicles also will be performing. So we're expecting a large crowd actually from Shillong itself and from other districts as well. So yes, when we're looking at the testing factor, hopefully, fingers crossed, a lot of people will come forward for screening as well.
This campaign, this is the first time we are hosting this Northeast Multimedia campaign in the state. But for other campaign this month music campaign, we are also doing it at the state level. But for the Northeast, this is the first time. So you said that the increase is still increasing. It's still increasing. Yes, that's what I think I had addressed that. I said it is a multifactorial. There are so many factors. Okay, it's not only. I think not only the health department to address to this increasing rise. Also, we need social factors, economic factors that we need to address.
That's why I see more people coming about to our services, more people coming about to the ICTC for counseling and testing center. So since we are still in that process of getting to the first 95 that all PHAV should do this status. So it's not that every year the number is increasing. It's more people are coming about to the test. But it's a good thing that more people are coming about the test. We can detect them early. We can put them on treatment early, so that we can prevent the infection from all the HIV to the other HIV negative person.
Citizen first is our motto. We believe that our citizens need to be connected with government for faster and efficient service delivery. I am happy to announce that we are coming up with a dedicated CM helpline call center